Hello, this presentation is brought to you by Therapeutic Articulations, the creator of the Mobil-Aider orthopedic device and iOrtho mobile app. This presentation is about knee mobilizations. We're going to talk today about anterior and posterior glides to facilitate knee mobility. Anterior glides are used to facilitate knee extension. They can be performed in either supine or prone. Biomechanically, it's always better to push than to pull. So the prone position would be a position of choice, but not everyone can assume that prone position. So the supine might be a necessity. In order to perform a supine anterior glide to facilitate knee extension, one would stabilize the proximal femur just above the knee, and then grasp the lower leg posteriorly as proximal as possible so that you're getting the most superior part of the tib fib, and then translating anteriorly parallel to the joint surface, right? So you want to pull from posterior to anterior to facilitate knee extension. The Mobil-Aider device is a device that was designed to enable us to quantify knee mobilizations. The device has an attachment, the HB attachment, that can be placed on the distal aspect of the device. That's the red attachment you see there. To contour to the tibia, the most proximal attachment curves around and relieves the patella and then applies pressure onto the distal femur. The straps hold the device in place, and then one would anteriorly translate the tibia on the femur, just like you would in any other knee mobilization in performing an anterior glide. So the learning curve is very minimal. The technique is just the same as you would see with your normal mobilization technique. There's the readout on the device. You can see there it gives you millimeters of movement, right? And once you set the device up, you stabilize proximal and you translate distal. You see the knee is in a position of about 15 or 20 degrees of flexion, right? That is basically your loose pack position. And you can see that the forearm of the clinician is also parallel to the joint surface. That is a good biomechanical position to be in to get that anterior translation of the tibial surface also parallel to the joint line. All right, so biomechanically correct for both the patient and the clinician. When performing an anterior glide in prone, the bolster is moved proximal, so it relieves the patella. So when you are performing the mobilization on the posterior tibia, you're not smashing the patella into the plinth. So cushioning the distal thigh enables you to move posteriorly with the tibia without compressing the patella. And in this case, again, you see the you see the forearm of the clinician in line with the direction of movement so that the translation is parallel to the joint surface. And again, this anterior position or this anterior glide in prone facilitates knee extension. And again, here is a video of that technique. Right? And here you see the person on a towel roll over the edge of the plinth as opposed to a bolster. So I'll just play that briefly for you again. So you can see that proximal control and the mobilization at end range. Using the Mobil-Aider device, you would use the HC attachment, that's the yellow attachment, and that goes on the proximal side, and the device translates distally. And again, you can see how nice and tight you are in the joint to be able to get really good control of that joint during the translations. Right? What's great about using the Mobil-Aider device is that if you wish to be able to perform a technique and want to be precise about it, allow me to give you an example. If the person's anterior glide is 4 millimeters and you decide you want to do a grade 4 mobilization, then you want to be at the end range, in other words, at that 4 mm barrier, and you want to have small oscillations. So you would be looking to the device to give you feedback at that mobilization being at the 3 to 4 mm range. Right? Small oscillations at the end range would basically confirm that you're doing a grade 4 mobilization. So here's how you put those pieces on. And then do that anterior glide. So like I said, there are advantages to doing prone glides. It's easier for the clinician to push than to pull. Gravity is going to assist the mobilization, and the patient can use gravity to assist their knee extension. In other words, perform mobilization with movement. Have them work with you as you're mobilizing them by actively extending the knee with gravity assisting them. For posterior glides, this would facilitate knee flexion, and again, with the idea of pushing instead of pulling, this would be done in supine, proximal knee stabilized, right, and distal knee mobilized. So a posteriorly directed force of the tibia on the femur. If you'd like more information about the device, the Mobil-Aider, you can go to iortho.xyz. And if you would like to purchase the app, iOrtho Plus, you can also go to that website as well. Please feel free to email info@iortho.xyz if there are any other questions regarding this video or the device or the app. Thank you.